This is Section 3, Dissociative and Affective Disorders. What disorders create sudden memory loss? Dissociative disorders are marked by intense disruptions in memory, identity, or consciousness. We'll take a look at 3 different dissociative disorders. The first is a fugu reaction. In a fugu reaction or dissociative fugu, there is a sudden loss of personal memory and the adoption of a new identity in a new locale. The second one is dissociative amnesia, and this involves a sudden memory loss, but one does not leave home or create a new identity. The third one is going to be dissociative identity disorder, or DID. This was once known as multiple personality disorder. It's when a person displays more than one identity, each of which may speak, act, and write differently. Each personality has its own memories, wishes, and impulses. Psychodynamic theorists see dissociative disorders as massive repressions of unwanted impulses or memories, resulting in a new person to act out these impulses or recall unbearable memories. Social cognitive theorists argue that one behaves differently depending on the situation. In a dissociative disorder, this variation is so extreme that one feels and is regarded by others as a different person. Memory loss may be an escape from unpleasant situations. Research suggests most DID sufferers have endured events that they need to forget, such as childhood abuse, are skilled users of self-hypnosis to induce trance-like state, and have found that they can escape trauma and stress by creating new personalities. Some skeptics suggest that DID may just be a socially proved method of expressing distress. And that does it for dissociative disorders. The next one is affective disorders. We wonder, how common is depression? Affective disorders, also called mood disorders because the word affect refers to mood, involve extremes of mood, especially if these extremes are inconsistent with the events around a person. We'll take a look at depressive disorders, and then there we have major depression and dysthymic disorder, and bipolar disorders. And within that category, there's general bipolar disorders and cyclothymic personality. So looking at depressive disorders, major depression, or also called major depressive disorder, involves feeling sad or hopeless for weeks or months. One often loses interest in all activities. Symptoms include feelings of guilt, inadequacy, and worthlessness, changes in eating habits and body weight, sleep problems, and poor concentration or decision making. In severe cases, people may express strange, false beliefs called delusions. Major depression may consist of a single episode, but more commonly episodes are recurrent. The second one is dysthymic disorder, and it is a less severe pattern of depression. One has sad mood, lack of interest, loss of pleasure in a milder form lasting for at least 2 years. A dysthymic person can still function reasonably well. The incidence of depression varies considerably across cultures and gender. It frequently first appears in adolescence, though it can appear at any age. And suicide is very closely tied to depression. Suicide rates differ depending on age, gender, and ethnicity. Suicide is the second leading cause of death among college students. Women attempt suicide more often, but men are more likely to be successful at it. Predicting suicide is difficult since suicidal thoughts are much more common than suicide attempts. In general, the risk of suicide is greater in people who have made a specific plan, have given away their belongings, and are impulsive. Although about 10% of unsuccessful suicide attempters try again and succeed, most who commit suicide have made no prior attempts. People who talk about suicide are at a greater risk to try it. It's a dangerous myth that a person is safe as long as he or she keeps talking about suicide. The second set of affective disorders are the bipolar disorders. And bipolar disorders are the alternating appearance of 2 emotional extremes, or poles. One extreme is depression, the other is mania, which is an agitated, usually elated emotional state. Mania features can include extreme optimism, boundless energy, delusions of having extraordinary talents, racing ideas, irritability, and impulsiveness. In bipolar 1 disorder, commonly called manic depression, episodes of mania may alternate with periods of deep depression. Bipolar 2 disorder is a milder form and consists of major depressive episodes alternating with less severe hypomanic episodes. Bipolar disorders are rare compared with major depressive disorder. And the last bipolar disorder is cyclothymic personality, or also called cyclothymic disorder, and it's a pattern of milder mood swings. Looking at the causes of affective disorders, first we'll look at biological factors. Twin and family studies suggest that mood disorders, especially bipolar disorder, have genetic components. Possible causes of mood disorders may be problems in the frontal lobes, the hippocampus, and other brain regions involved in mood. Imbalances of several neurotransmitter systems, especially norepinephrine, serotonin, and dopamine, may be important. Hormonal systems that respond to stressors appear to be overly responsive in depressed people. This may explain the observed link between depression and stressful events. Disruption of the body's biological clock may also play a role in some cases. Many depressed people tend to have trouble sleeping. Seasonal affective disorder, or SAD, appears to be caused by disruptions in circadian rhythms during shorter daylight months. Exposure to a few hours of light a day alleviates symptoms in many cases. And the psychological and social factors. Biopsychosocial explanations emphasize the impact of anxiety, negative thinking, and other psychological and emotional responses caused by trauma, losses, and other stressful events. Social cognitive theory suggests that the way people think about their stressors can increase or decrease the likelihood of mood disorders. These explanations are consistent with the diathesis stress explanation of a disorder, that certain cognitive styles serve as a predisposition that makes it more likely that depression will develop in the face of stressors. Depression may be due to learned helplessness, a learned feeling of a lack of control over one's life, especially stressors. Aaron Beck's cognitive theory says that depression develops from poor mental habits. People blame themselves when things go wrong, focus on and exaggerate negative aspects of events, and jump to overly generalized pessimistic conclusions. A negative attributional style may be an important cognitive factor in depression. Long-lasting depression is more likely among those who attribute problems to a permanent, generalized lack of competence rather than to a temporary or external causes. A negative attributional style is a risk factor for depression, not just a result of it. And depression may be more likely in those with a ruminative style, which involves a tendency to dwell on negative events, on why they occur, and on feeling depressed. Depression may be less likely in those who use a distracting style, which involves pursuing activities that help counteract a negative mood. And that's it for Section 3, Dissociative and Affective Disorders. The last section is Section 4, and that will look at schizophrenia, personality, and miscellaneous disorders, as well as their link to law and crime.